callers and not necessarily those of this station, its staff, management, or sponsors. Welcome to the Ask the Experts show with local experts in the fields of legal, health, financial, and home improvement. Enjoy being educated in such topics as personal injury law, community association law, family law, bankruptcy law, along with health show topics like pain management, men's health, and dental implants. Now, sit back and enjoy today's Ask the Experts with host Steve-O.
Hey, good afternoon. Thank you for tuning into the Ask the Expert show. We are on every Monday and Tuesday from 6 to 7, and we talk about anywhere from legal, health, financial, and home improvement. We have some of the greatest experts on our show. We've got two great shows today. We are on, just so you know, we are a live show. We are on 103.9 FM, 95.3 FM, 1470 AM, and 96.9 FM. 4 stations. So you're able to catch us no matter where you are in the car. And a week from tonight, next Monday, we're going to have some surprise guests from the White House. Not one, not two, not three, 4 big names from the White House on our show next Monday night. I guess we're looking for our first show guest, and I don't see him on here. Oh, there he is. There he is. So our first show tonight is going to be talking about a little bit about sex, which is okay to do now. And especially if you're having problems, you do not want to miss today's show. We have one of the leading experts. You know, the little pill's not all you can do anymore. There's so many other things. And we have got the Broward Urology Center, one of the top urology centers, not just South Florida, but all of Florida. And let me introduce you to one of the partners, Dr. Eric Shenvin. Hey, Eric.
Hey, Steve. How are you?
I'm doing good. How are you? Everything okay? Everybody healthy?
Everyone's good here. Yeah, it's tough. We're taking a lot of precautions, but trudging through it and really back to business, I would say. Just, new lifestyle, extra caution.
Your practice is open, even though there's a virus out there, but you are open for business.
We're fully open. It's, we're social distancing in the office, limiting traffic in the office. Sometimes patients are waiting in their cars, really trying to limit family members and just have the patient alone in the rooms. We're still doing a little bit of telemedicine. I have some patients that are stuck in Ohio, New Jersey, all over the place, and are with family and friends elsewhere. So I am doing some telemedicine, but we're back operating full schedule, and the hospitals are fully up and running at this point, especially this week now.
So the hospitals are open. They haven't closed elective surgeries down.
Broward Health Medical Center did for a while, like Memorial, and I believe down Jackson and some other places in Miami. There was such a high volume of the COVID, it was spilling from Miami-Dade County up into Broward County, and the Memorial system, further south, was taking more of a brunt, and then it started coming up into Broward. But that has been lifted, and we're back on fully elective schedule.
Okay. We get new listeners every week. Please tell everybody about your practice.
I am I guess I would say, general urologist with minimally invasive endourology laparoscopy fellowship training. And I also have developed really a special interest in sexual health, sexual wellness, and dysfunction. and that has really become a large part of my practice and continues to grow day to day. We're located in downtown Fort Lauderdale, and there are three of us: myself, Dr. Yogel, our senior partner, and Dr. Gorbati. Dr. Fowler was with us a little while ago and retired about 8 years ago. He started the practice, and we continue to grow.
Well, I think tonight's show, we're talking about great sexual function, and there's more than just a pill. That there is so much more, which we're going to talk about tonight. Um, just out of curiosity, there's about three major pills out there. Is that right? That are by
Probably
prescription
four
only.
now. Probably four now.
They're by prescription.
They're by
And
prescription and generic too now.
So somebody wrote the other day, because they knew you were coming on the show, somebody keeps advertising out there that there is a blue pill that works just as good that you can buy over the counter. What about these over the counter pills?
I think they're very dangerous, and a lot of them have ingredients. Some don't even list the ingredients, and certainly this day and age, people can Google and search online a lot of those ingredients and get some idea what they are. Some of those have cardiac or heart vascular side effects. They could raise or lower the blood pressure, and in combination with some other medicines can be dangerous. I think that I have an interest in learning more about some of these herbal therapies. I call them the stuff you find at the gas station and at 7-Eleven or something like that. Because some of the patients do say that they help. The patients are try and get them to be open and honest when I'm doing an interview, and they'll tell you that they help, but when you don't really know how things help, we have to be cautious and careful. And I think that's really what I explain to the patients. But there are also
I
some of
don't
the things
think,
that are not just over the counter, right? And that's kind of what I was getting at when you and I were talking about that it's not always a pill that just fixes everything. And it's easy, and we all would like to just pop a pill and everything's magically better. So we now hear about some of these online services, Hims, where you can order medication, and Roman, where
heard
they
of
do
that.
a quick little interview online, and it's almost like the medical marijuana card when it was in California, starting there. And you walk up, hey, how you doing? It sounds like you got a headache. Here, let me give you some marijuana. We'll just sign up for your card. No one really gets a thorough history on you. You may be wasting your
Right.
money, you may be wasting your time, and you may actually be putting yourself in harm's way for a medication that maybe wasn't right for you.
I am so glad that you brought that up because you see companies like Roman doing a lot of advertising, and it's like it's a phone call and they send it out to you. But use some common sense. What you just said is these pills can be dangerous. They're not FDA approved, and just because they say that they were done in an FDA approved lab does not mean they're FDA approved.
Correct. Even the prescription ones that Roman and Hims are doing, which are the generic versions of the brand names like Viagra, Cialis, Levitra, Stendra, that again, some of those medications, there may be cardiac patients or taking other medications that, again, I think they're really just trying to sell you the medicine, kind of do a CYA quick little medical history, but it's really not someone spending a good amount of time really considering everything that's there at hand and everything that should be evaluated in a full medical evaluation.
You work with a lot of men and you do a whole history and physical before you do anything, which I want to talk about. But do the men that come in to see you think this is it? This is the best I can get? and kind of like throw their arms up in the air until you actually sit down with them and show them there are other possibilities?
Well, some of the men think that because their doctor, sometimes even another urologist, has told them that, and that there's nothing left for me to do. Maybe it's the pill, maybe it's an injection. We, again, just like you said, we hear on the radio, we hear all the time, every day in, day out. I'm hearing about these men's clinics and wellness
Yes.
clinics doing they've got a magical treatment that please come in and let's find out about, when the reality is these are injection medicines 99% of the time, that we as urologists are trained from day one in a 5 or 6 year residency to really learn how to use these, dose them, treat the patients, and even evaluate the patients properly. And unfortunately, a lot of times, even when the patients are getting these, they're getting them at way above what the medicine should cost them in these very expensive programs with visits that would have been covered under their insurance, that they're now kind of have the wool pulled over their eyes. And a lot of them come to me very disenchanted with how they were treated and the thousands upon thousands of dollars that they wanted for a medication that's $150, and a consult that should have been covered under insurance, and so on.
Does Medicare cover any of this at all?
So most of the ED treatments, ED, erectile dysfunction, are not covered under Medicare. There are some insurances that will cover a small number of pills, and those insurances are getting fewer and fewer every year. The injectable medication that we sometimes use is pretty much not covered. I think I've had one insurance cover it in 17 years, and that I even question. But we do everything that we can. We do the visits, we do any evaluation, any testing, like an ultrasound. It all can get done under the insurance. So we try and work with the patients and their pocket, at least in that respect.
We're going to go to a quick break, and we come back. I've got so much to go through, but the first thing I want to do when we come back is tell me, I know high blood pressure, thyroid, there's a lot of reasons why men are going through ED. And then we're going to talk about some of the things that you do in your office, because I think, listen, this can kill a marriage, a relationship, and I think it's so important what you do. Give everybody your phone number, Eric.
Our phone number here at Broward Urology Center is 954-463-6408.
And your website?
Just that simple, BrowardUrologyCenter.com, and you can find us on Facebook as well.
Okay, we're going to go to break. When we come back, we have more with Broward Urology Center, Eric Chevron.
Are you suffering from erectile dysfunction, also known as ED? The urologists at Broward Urology Center can help men regain their sexual health in a comfortable, discreet environment. ED can result from age, low testosterone, high blood pressure, diabetes, smoking, sleep apnea, high cholesterol, and cardiovascular disease. When a man is first seen in the office at Broward Urology Center, a thorough evaluation is done by the doctor, which begins with an open, honest, and absolutely confidential discussion about their overall medical health and current sexual function. A complete physical exam is performed, and blood work is often ordered. Once a full workup is completed, a customized treatment plan is designed for each individual patient. They offer all treatments for ED, including the newest shockwave therapy and the P-Shot. Contact the Broward Urology Center today to discuss all the different options they offer for ED at 954-463-6408.
And we are back. This is the Ask the Expert show. We're on every Monday and Thursday from 6 to 7, drive time. And we have Dr. Eric Shenvin on the show with us today. Broward Urology Center. He's one of the top urologists in Florida. And we're talking about erectile dysfunction today. Eric, tell people usually what are some of the causes? Because I know high blood pressure is one.
So, well, overall cardiovascular disease is probably at the top of the list. We think about clogged arteries in the chest and the heart, meaning, but rather those arteries to the penis are much, much smaller and can clog up much earlier. Other factors like hypertension and diabetes can affect the arteries, they can affect the nerves, other neurological problems, and so on. And low testosterone, those are some of the big ones. We've talked about a lot of these before. I think some of the stuff that I wanted to bring up when I take a thorough history on someone, and that does actually take a little bit of time, is their overall general health, their nutrition, their diet, their exercise. Are they on one of these fad diets and HCG diets and drop in weight super fast? You'll get other hormonal changes in the body, cortisol levels, thyroid levels. All of these play a role in not just ED, but also just overall well-being and sort of that sexual well-being. Sleep is a huge one. And not just the people that have sleep apnea and are really not getting a solid night of sleep, and there's a strong association with low testosterone with that, but people who are just not sleeping enough. And, maybe they're physicians that do radio shows and, we get so busy and clammed up with work and everything going on, and our kids are in school at home and just everything. Getting a good 7-8 hours of sleep a night is important, and again can affect other hormone levels that can affect your testosterone that can then play into your sexual function.
So if I come into your office and I'm a diabetic, I have hypertension, can you do anything for me?
There's lots of stuff we can do for you. I mean,
Okay.
first of all, it's, as I was sort of alluding to, is I'm going to find out what you're doing for you already. And of course, your medical doctor and your other medical doctor is taking care of you. Are your sugars in control? Is your blood pressure in control? So you're properly medically managed. The diet that you're doing as a diabetic and a hypertensive, the exercise level that, again, we talked about the diabetes and the hypertension all playing into cardiovascular disease, and we see it's all just kind of circling back around, which is then going to come back around and further affect ED and other sexual dysfunction and so on. So as long as everything is sort of in good shape, and we all want the easy way and can try the pills and so on. But these are the diabetic patients tend to be some of the most difficult ones. So those are the ones that we're going to evaluate with an ultrasound and discuss either trimix or bimix type of injections that directly act on the penis to cause an erection, or regenerative treatments like the P-shot and the shock wave to repair and regenerate blood vessels and the tissue itself so that it responds better to testosterone. We're going to talk about your testosterone and make sure that it's within sort of normal levels, because we know that sexual function is dependent on the testosterone. So we can't kind of look at A without looking at B.
Do you notice that men who come in have waited a long time before they come in? It's like they have to get up the nerve to come in.
It's almost like a bus had to drive through their house sometimes. And, this is sort of sometimes sensitive and sometimes, embarrassing macho kind of stuff. So we all sort of understand it from that point. But as we've also talked before, sometimes the ED is that harbinger, the sign that there is cardiovascular disease going on in younger patients that really are not going to the doctor yet, but really need to get an evaluation, because these may be those patients that end up having heart attacks or even a stroke and surgical intervention long before what we're used to seeing and prior to age 50. So
I
definitely
was
part.
shocked I was really shocked to find out a 20-year-old can have low testosterone. I did not know a young person could have testosterone.
It's not a common thing, and certainly in those patients we think about, are these guys using anabolic steroids in the gym and then have
Oh,
stopped, and now unfortunately their system is kind of shut down from taking the steroids for too long. We see that happen. It's amazing that I don't see more of those patients coming in, but I wonder if they're just still now self-treating at home with the testosterone that they can't ever get off of. But anemia is another factor that I thought of recently that we don't think about. Fatigue, and just your overall sexual function. It takes more than an erection to be sexually active and to have, as we talked about, a great sexual function. It takes two to tango, I always tell a
yeah.
patient. So I ask them about what's going on with their partner, man, woman, whatever it is. Are they having issues in sexual function? And some of the typical stories we used to hear and tell, from when Viagra first came out as the first drug in the market, 20 years ago, about elderly men now able to come home with an erection to a partner who hasn't had intercourse, usually women in that case, for God knows how long, and are not quite ready for that. So, as a woman who's postmenopausal, they may need to go on to an estrogen cream. They may not need to have their testosterone levels and estrogen levels checked so that they're properly managed, because, again, it takes more than the physical attributes to have an intimate
Right.
relationship.
Well, I've learned today is that sleep, diet are very strong, that you need those, and that when they come to see you, it's not just you're going to give them a pill and they're on their way. There is so much more to this. And I'm telling you, and you see females too, it's not just males. You also
Sure.
see females. But I'm telling you, if you feel like you have a problem, at least you know you can go to somebody who understands your problem. I mean, he has a urology center, but you really specialize in ED, Eric.
I see a lot of it. It's becoming, it has become a special interest of mine that I've really taken the time to do some extra training in, beyond which I've learned back in residency and all along. We're just seeing so much more low testosterone, low T, erectile dysfunction, and sexual dysfunction in women. And in women, we know menopause hits, and a lot of women have physical conditions that they don't want to have intercourse anymore. Just the overall condition, to female genitalia, uh, lack of lubrication, discomfort, atrophy, that doesn't lend itself to just continuing on with your sexual intimate relationship without a little bit of help. But it's certainly something that we can do. And I think, you mentioned about understanding. I think a better part of that is caring. And a lot of us in medicine today are super busy and trying to just everyone's just rushing through the office, And the last thing on most medical doctors, gynecologists' minds is, let me ask you about your sexual function. We got your
Right.
blood pressure, your diabetes, your thyroid level. You got this other cancer. You got blood coming out of here. Did you get your colonoscopy? And there's so much there that sexual function just get pushed way down the ladder.
Let's give everybody your phone number.
The phone number here is 954-463-6408. It's Broward Urology Center. You can find us on the web at browardurologycenter.com, and we're on Facebook as well.
Eric, thank you so much. You're like just a wonderful guest. And Eric will be back again next month with more of Ask the Experts. Have a good week, Eric.
Thanks, Steve. You as well.